This conference will now be recorded.
Well, welcome everybody to our second GAMP Data Integrity Special Interest Group meeting for 2019, or actually I guess it's technically our first one. Appreciate everybody being here. Let me go ahead, if you want to move to the next slide, Barbara. I'll kind of go over the agenda for today. What we're going to cover today is just a brief welcome. I'll fill you in on a great change that we've had, or a great addition that we've added to the SIG leadership team. Chris Clark from the GAMP editorial review board will talk about the PICS DI guidance draft 3, and he'll fill you in a little bit on GAMP's role in helping to collect and collate comments associated with that draft. Chris is actually the one that's been driving a lot of that activity for GAMP and ISPE. Bob Weary is also here. Bob's a member of the GAMP America Steering Committee. He's going to talk about the FDA DI guidance that was officially released in December of 2018, and talk a little bit about some of the changes that occurred between the draft and what actually came out in the final document. Lori and Charlie will provide an update on the SIG and some of the guide activities that are going on, and then Christopher and I will talk a little bit about some upcoming meetings and conferences and education opportunities. So let's jump to the next slide. First of all, I'd like to welcome Stuart Jones to the DI SIG leadership team. Last year, probably about 9 months ago, unfortunately, Nigel Price, who was our European representative on the leadership team, had to step down because of some other business things he was working on and just didn't have the capacity. So we are fortunate to be able to get Stuart to join our group. He's actually a manufacturing director and part of the Data Integrity Center of Excellence for Merck in Dublin, Ireland. He's got a background in chemical and process engineering, has 20 plus years experience in pharma manufacturing, including process engineering, system validation, lab systems, IT, and so forth. So he's also a member of the GAMP EMA steering committee for the last 3 years. So we're glad to have Stuart join us and to have a new representative from the European area as part of the leadership team. So we now have all regions again represented within the leadership team. So Stuart unfortunately is not able to be on the call today. He's actually in Singapore on business, and I think it's midnight in Singapore, and he's got an awful lot of things going on there. So again, please join us in welcoming Stuart. Let's go to the next slide.
I'm going to interrupt for a second.
Sure, go ahead.
Mike,
jump in.
Just because one of the things that the LT has been discussing is the idea of trying to figure out how to engage the rest of Asia Pac, except for Charlie, who is willing to get up at 3 in the morning, how we can better engage that area of the world.
Sure.
I don't know if there's anyone on this call from that region. If you have ideas, we're thinking we could transition and do a meeting at that time. The leadership team is more than happy to get up at some absurd hour in the morning to accommodate that part of the world on some frequency. We would just like to make this as global a team as possible because we need that input from all regions of the world. So if anyone's on this call and has ideas, please post them or send them to us because we're really interested in trying to expand this group and include everybody. Thank you.
Absolutely agree. I think this is truly a global SIG, so we definitely want to do that. Chris Clark has joined us. We're going to go ahead and shift gears. We're going to talk about the PICS consultation, feedback, overview, and so forth. So, Chris, I'm going to turn it over to you.
Okay, thanks, Mike. Can everybody hear me okay? Because I had some connection problems just as the meeting was starting. So joined a little bit late. I wasn't able to check whether you could hear me.
Yep, we can hear you.
Okay then. Barbara, do I have control of the slides or not?
I was going to ask, so do you want to just go through your slides and then let me give you control, so you can show the guidance, or because you'd have to be able to show this presentation
No,
also, and I don't know that you have it.
Yeah, if I just ask you to, if you just change the slides when I tell you to change them, that's fine.
That works for me. Okay.
Okay. Let's not prevaricate any longer. Okay.
Okay.
Well, hi everybody. Thanks very much for inviting me to your SIG meeting. If you could go to the next slide, please, Barbara. Okay. So as many of you may be aware, the PICS organization have recently published some guidance, which is guidance for their inspectors to allow the inspectors to have some background information and some steer as to what they would try to find or what they would be looking for during an inspection of GDP or GMP facilities. Now, this guidance has been in quite a long gestation period. This slide indicates that obviously the whole purpose is to try and facilitate a harmonized approach to the inspection, so that whichever region of the world the inspector comes from, if they're a member of PICS, then you can expect them to be taking a similar approach. Now, the first draft of this guidance was produced by PICS in August 2016, and as a result of that and getting feedback from various different authorities that were involved in this trial period, it was decided that they needed to update the guidance to expand it somewhat and then move it forward to the third draft. So can you change the slide, please, Barbara? Okay, so how come ISPE have got involved in this process? Well, ISPE were invited along with 3 other organizations to select collect and collate responses. So as you can see, there's ISPE, there's the ECA, there's IFPMA and PDA. So quite lucky to get involved in this process, and it's a process which I think that we've tried to take quite seriously. Now the document, the third draft of the guidance, which is numbered PI 041-1, they wanted it to be subjected to a focused stakeholder consultation, hence selecting 4 organizations rather than sending this out worldwide and getting all sorts of interesting comments back. That's not to say we didn't get some interesting comments back ourselves, but they were quite specific in what they wanted. They wanted substantive comments, so they weren't looking for minor issues, small editing issues or anything like that. They wanted very substantive comments as to what they'd written, and they wanted them in line with some specific questions which they asked as part of their consulting process. In parallel to this consultation, the draft is being applied by various PICS participating authorities on a trial basis for a new implementation trial period. So they wanted to see how it would fly in the real world. And as I said, the review was subject to some strict commenting guidelines. So can I have the next slide, please, Barbara? Thank you. These guidelines, I've tried to summarize them here. They went on a little bit longer than that, but clearly they were after some technical and scientific feedback. Any feedback they received needed to be have some sound justification applied to it if it was requiring any changes to the document. They wanted the feedback to be quite specific, and if it was requiring some substantive changes to the document, they wanted those changes to be written in a way that could be substituted for what in a language that could be substituted to what the regulators proposed. Comments had to be limited to what is contained in the document. They didn't want you to comment about other regulations that might be around. You may point to other regulations when talking about your comments, but that you're not commenting on other regulations, just what's in the document. You had to be very specific as to where your comment was being referenced to. they wanted, and they were very clear on this, they wanted information, the information requested in each column of the template. Comments lacking any of the requested information, they said, would be eliminated. So we had to make sure that what we put in our response met those guidelines. If there was any incorrect grammar in a document that could result in a misinterpretation of the requirements, then they asked us to note it. But what they didn't want was for us to go, if you like, a line by line, a word by word editorial process. They weren't looking for us to re-edit the document. They really wanted us to comment on, is this, you know, is this okay? Will this work in the real world? Is this applying some unnecessary burden? Is it overcomplicated? That type of thing, not a line-by-line editing process. And what they did was they provided a commenting template in Excel format, which in itself provided a challenge, that requested answers to 37 specific questions. And that's how the feedback was supposed to be provided. So we obviously got a lot of feedback from various different people. What I want to do is just quickly give you an idea of some general observations on the process that we saw as in the group who were putting together the feedback received by ISP. So could I have the next slide, please, Barbara? So unfortunately, a lot of the feedback that I received didn't actually comply with the commenting guidelines. So it didn't align with the template structure. There wasn't any justification information. Sometimes the feedback was very specific to particular technologies, and the idea of the guideline is that it's supposed to be reasonably generic and can be applied generically. There was a lot of feedback we got which had inappropriate, in terms of the guidelines, inappropriate editorial comments and requests for grammatical and language changes, because they weren't actually going to improve the clarity or improve people's understanding of the document. It was almost like some people were saying, I would prefer it to be written this way, without any particular reason for saying that. Some suggestions may have conflicted with GAMP principles and practices as well. And given the fact that, you know, we're commenting from ISPE and we are representing GAMP as well, then we needed to make sure that we didn't send anything back to PICS that would be in conflict with what we say in GAMP. So what I've done is we had lots, I mean, we had masses of comments back, and it took quite a long time to collate all these comments. And in fact, they're still being collated to a certain extent. The commenting deadline for people from the commenting deadline set by ISPE was the 28th of February. The actual deadline for ISPE to submit comments back to PICS is actually towards the end of this month. So I actually still have a little bit of time to try and tidy up the comments, because I've had to look at the comments. I've had to take a position on what some of these comments are. I may have put too much in. I may have put too little in. I'll be discussing that with other members of the GAMP leadership team so that we can make sure that what we submit meets the guidelines of PICS. PICS don't get fed up that we're actually being a little bit too picky. They feel as though we are actually making substantive comments and that we have actually something to offer to them. What I've done now is the next few slides will provide some general themes and examples of the sort of comments we got back. The spreadsheet is extremely long, it's extremely complex. If I was to go through every single comment, you'd all be asleep within about 5 minutes. So this is just to try and give you a bit of an idea, and I thought it'd be useful to have a look at the themes so that you know what people are commenting on. So could I have the next slide, please, Barbara? Right, so to all intents and purposes, there were three main themes that arose throughout the commenting. A lot of comments seem to pick up on that certain definitions used within the guidance were either contradictory, or in a lot of cases phrases and terms were used and there was no definition of what they meant anyway, or some other definitions required clarification. So we'll have a look at that in a bit more detail. There were a lot of comments about some over-prescriptive or burdensome requirements being set by the guidance, and we'll have a look what they mean by that. And then there were some comments that seemed to indicate that what PICs were proposing might provide or might present some technical difficulties. So if I could have the next slide, please, Barbara. Okay, so let's have a look at some of the points that people made about definition or clarification of definitions and what have you. It was obvious that within the guide, certainly from the number of comments that came back, that PICs had used similar but not identical definitions of certain phrases and words when you compared those definitions with other regulatory authority guidance documents. So we felt that this doesn't maximize, if you like, the opportunity for harmonization. It seemed as though they were almost coming up with a whole series of definitions for themselves, whereas they could have picked up definitions from the FDA or the MHRA, for example, and just applied those straight away in the guide. So we felt that was a missed opportunity. They kept talking about GMP and GDP, but they didn't always do that consistently. And we felt that it might help, for example, if they used a more generic term like GXP, because DI principles and practices should be applied across all regulated areas. It's almost like they were trying to pick out some special cases, and unless there was justification for special cases, they weren't really showing that. So we wanted them to try and make it, in other words, try and make it a little bit more generic. This is a specific comment just to give you an example of the sort of thing that comes back. So the term data quality appears in section 511 and a number of other sections, but sometimes the term is used alone, other times it's used alongside data integrity. So you'd get the phrase data quality and data integrity. The problem is that the term can have different meanings, but it's not defined in the document. So that's an example of how they could improve the clarity. Section 642, for example, introduces the term valid, complete, and reliable, whereas section 312 refers to data integrity and reliability. So what are these the same things? Are they talking about something different? Because they both have the word reliable in them. They both have the terms, you know, data integrity would indicate that something is valid, it is complete. It would again be helpful if they would use common terms, because they were talking about effectively the same thing. And even something as simple as like they use the term true time. Now, what they actually mean is they're talking about real time. And I think most people would use the term real time. So it would help if they would try and sort of clarify situations like that. So that's a flavor of the sort of comments that were coming back and how they need to do some clarification on definitions and improve that to help people's understanding. Could I have the next slide, please, Barbara? Right, the next few slides all cover the area of something being, the guidance being over prescriptive and burdensome. It was felt that if some of the text in the guide is accepted literally and prescriptively, the regulatory burden may be significantly increased. So that was an overarching comment that we made based on comments that other people had made. So the guidance is effectively, it's pretty sound, it's pretty good when it's discussing the principles of data management and data integrity. But problems arise when it starts to suggest some pretty prescriptive detail for computerized system technical and compliance activities. And this is primarily in section 9. Section 9 is covering things that does cover areas such as computer systems validation, etc. So for example, there's a discussion in there on the validation summary report, and it's got so much detail in it, and it's written in a way that seems to suggest this is the way you should do it, but it's not the way we would do it per normal industry good practice. They're asking for far more detail that would usually be put in a validation summary report in good practice. A lot of the detail, a lot of the information, it was felt, could actually be found in other project lifecycle documents or other operational procedures. So they were asking for something which is not normally seen as common practice within our industry. So we felt that we had to sort of point that out. Can I have the next slide, please, Barbara? Thank you. They make a number of references to Annex 15. This is EU Annex 15. But in actual fact, it was felt that the correct annex they should be talking about should be Annex 11. And so we felt that there was some problems with the references there. The draft also talks in what we would say I'm using the term old-fashioned. It talks about IQ, OQ, PQ terminology. And really Annex 11 itself doesn't prescribe such terminology, and what they were saying doesn't really follow the approaches normally adopted in GAMP 5 or ASTM E 2005 or Annex 11. They're not really talking about that. We felt that they should be pointing to that a bit more, because they allow a much more flexible approach. What they describe is quite burdensome. They suggest that particular activities and terminology are mandatory in all cases, and that's not really true. I mean, different people do different things in different ways. They call it they may call it different things. I think they're not really saying that, well, you know, this is the principle you should be following. They're rather being very prescriptive about exactly what things should be called and exactly what order things should be done in. So we found that that was a little bit unhelpful. The draft also makes the suggestion that the audit trail should include the name of any person authorizing the change. Now, this actually goes further than what Part 11 or Annex 11 says. It's not current accepted practice. What we mean is there should be, I'm not saying that you shouldn't be able to identify who made the change, but they're actually asking for the person's name, not some unique identifier. So they're actually going a bit further than the current regulations. So we felt that they needed to go back and look at that. Next slide, please, Barbara. Thank you. They set some expectations on the recording of unsuccessful login attempts, and these expectations are very detailed and very prescriptive. And a number of people felt that it may not be possible to do this with current technology and current available systems on a lot of manufacturing equipment, which of course can be subject to the same data integrity practices and principles as computerized systems. So we felt that they'd probably gone a little bit too far there. They also set some expectations on restrictions of USB devices, which are very detailed and again very prescriptive. We're just asking the question, do they really believe, are these realistic and achievable? Because we didn't feel that they were, and gave some reasons as to why we felt that might not be the case. The text also states that it should be possible to print out a legible and meaningful record of all the data generated by a computerized system, including metadata, which is an interesting thought. And this is obviously we felt this is unrealistic and probably impossible in most cases, impractical and unnecessary. So, for example, in the case of LIMS or ERP or other systems, that, you know, it may not be a requirement. We felt as though they didn't maybe fully understand the capabilities of some of the technology, in saying that you had to print out every single piece of information, or had to be able to print out every single piece of information from that. I mean, a lot of other guidance talks about being able to recreate the situation in which the record was generated, but to print everything out. So we certainly question that. Next slide, please, Barbara. Thank you. So that was some examples of something, you know, things that were overburdensome, over prescriptive. The third theme was technical difficulties. So one of the things that they talked about was retaining electronic data throughout the required retention period. Now this is interesting, because we pointed out to them that many systems don't have a mechanism for converting data into a storable form that can be archived. So so meaning that if the software becomes obsolete or unsupported on an operating system, the data may not be able to read. And we said that, you know, they need to think about what exactly is the objective of what they're trying to do here. Because they kept, one of the things that we noticed was that they kept, and this is in the this is probably on the next slide actually, so I won't go to it just yet, but they kept talking about archiving and backup, etc. And which was interesting. So whilst the requirement to keep hardware and software to enable reading of data that can't be converted to a new format seems reasonable, can it be assured in practice, especially with R&D data which may be kept for 30 years or more? Again, we're sort of saying that some of the practicality of some of what they're asking, it may not be possible to do that at the moment. And then how far would we be expected to go to safeguard against possible fault in the retained hardware software throughout the retention period? Again, if you're talking up to 30 years. So, it's not only the hardware, but it's a full backup or full set of parts to cover any possible failure mode. Is that what they're expecting us to do? They don't explain that. It's not clear in the document. Next slide, please, Barbara. So so I mentioned about the fact they use the term backup and such like. Throughout the document, where they talk about backup and archiving, they use the terms interchangeably, but they're not one and the same thing. So, for example, one bullet point looks to backup for the purpose of disaster recovery, but in the next list of the same bullets, it requires backup for the defined regulatory retention period. So what are they talking about? Are they talking about backup or are they talking about archive? Because they're not necessarily the same thing. They seem to be confusing them. There was a risk of confusion in Section 8, which is about, Section 8 talks about specific DI consideration for paper records, but it actually contains themes which may be more appropriate for electronic records. So they maybe need to put some added context in there to sort of say, well, why have they included certain things in these subsections where it looks like they're talking about electronic, where they're actually in a section talking about paper. So we need to think about that. So we pointed that out to them and felt that they needed to do something. So again, that's a flavour of the sort of feedback we got. There clearly still seems to be a little bit more work to do on their part, or we'd like to think there's some more work for them to do. This is not to say that there's not a lot of good stuff in the draft guidance, and we did point that out to them. We thought, well, we can't just come back and say it's not very good, it's not, this, that, and the other. So there is some good stuff in there, but there are some issues that still need to be dealt with, and that will obviously be getting submitted pretty soon through ISPE to PICS. Whether we get any response to it or not, I don't know, but I'm not sure how that's going to happen. But anyway, it's been an interesting exercise. It's been interesting trying to collate all the data together. It's come back in several different forms, varying from some comment in an email to people actually filling in the Excel spreadsheet, to people sending information in Word documents, and then I'm having to try and interpret what bit is it they're talking about. So it may well be that not every single comment that's been submitted has ended up in the spreadsheet, but a version of it may be in there because it's been covered by other people. But these were the themes that just about everybody who commented maybe had some points about. So it gives you an idea of the sort of things that we've been looking at. But anyway, that's all I have to say about that. So that's the end of that. Thanks, Barbara.
Thanks, Chris. Appreciate you. I know you put a lot of time into pulling all these comments together. It's not been a trivial task, so greatly appreciate you doing that, and appreciate you coming and giving us kind of the 10,000-foot summary, because I know I've obviously seen copies of the comments, and it's pages and pages and pages. So, but I really appreciate it, and if again, appreciate folks who actually did submit comments as well. And ISP was and GAMP was very lucky to have this opportunity to actually be one of the 4 groups to receive the comments. So we're trying to live by their rules so that way we can do this again in the future. So appreciate it.
Yeah, no problem. Next time I stick my hand up to volunteer for something like this, just say to me, remember the PICS guide.
Remember PICS. Yeah, just say PICS, and you'll very quickly drop your hand. Yep.
No problem. No problem. No, it's been great to have the opportunity to do this, I think, from ISP's point of view. So no, it's not a problem. So thank you.
All right. Let's go ahead and keep moving on, just in the interest of time. Bob Weary is with us to talk about the FDA draft guidance, or FDA, it's now no longer draft, it's approved guidance that came out in December. So I'll turn it over to Bob then.
All right, thanks very much. Thanks, Mike. One of the roles in the GAMP committee is covering these sorts of regulations, and so I put together something. I'd like to share my screen now. I think I can do that.
I'll have to give you control, Bob, so just one second.
All right, sure.
Okay, you should have control.
All right, so let me just All right, can everyone see that now?
Yes.
Okay, so what I'd like to do is I'd like to go through very quickly the draft guidance that was issued in April 2016 and show what was deleted from that. And I'm going to just do that very quickly, maybe 5 minutes or less. And then I'm going to go through the finalized guidance that was issued in December 2018 and highlight what was changed and make a few comments. So basically you can see that there's not been a whole lot deleted from the draft guidance. Here, this audit trail being a chronology, it's really not. It supports a chronology. And then again, I think FDA has the same problem with the backup terminology as PICS does. They changed decision making into release of batches, which you'll see in the finalized guidance. Here they talk about in what to do in small operations. They completely deleted this. I think they felt it would be too many companies would use it as an excuse to circumvent what they want done. So I think they dropped it. Similarly here, they completely dropped all of this, and that you'll note in the finalized guidance, they switched around questions 7 and 8. And so those are now backwards from what's in the draft guidance. A lot of just cleanup of words. Here they just dropped any reference to the Federal Register. They figure it should be self-explanatory if it's like almost, 50 years old. So, and then again, this kind of odd temporary memory, this very prescriptive statement. So I think they dropped it because they felt they were overstepping. And then they dropped this first reference to the application integrity policy, but you'll see on the finalized guidance, they did keep it under question 18. And then they dropped this veiled threat that FDA may conduct an inspection. So, all right, so now having covered that, let me go to the updated guidance. You'll notice that they've inserted drug, and they've noted that question and answer guidance, which fits in with the ICH format, I think, a little more cleanly. Here, you'll note those are reversed from what they were before. And then moving forward, the first start is they've inserted this paragraph primarily about management responsibility, sort of fitting in with the concepts in ICH Q10 and what's already in the 820 regulations, but it fits in there. Then they've added a series of questions. When considering how to meet these requirements, ask the following questions, and they're listed here. These are likely derived from ALCOA criteria, and I think the most common 483 and warning letter violations. I've done an analysis of them, and I think that's where you get the comments about complete data from these 483 and warning letter violations. So it's likely there. They've also added this, again, not so veiled threat about additional enforcement warning regarding submission applications, so that, if you have data integrity violations, it could affect how they view the rest of your data on applications and stuff. All right, and I didn't catch that someone asked if these annotated documents could be made available. Of course, I've sent them to Lori, and she can forward them on. So here they've inserted this paragraph. It's primarily about a data life cycle, and that didn't appear at all in the previous document. So I think that's a good addition. And then they talk about all the different kind of attributes the way they do in Part 11, or activities that happen, and reemphasize design and controls, which I think is really a big key in terms of how they want to analyze whether or not you have data integrity in your systems or not. It's all about, did you design it properly and are you controlling it properly? Under their metadata definition, they've added additional metadata examples related to very GMP specific ones, but material status data and the ID number. Again, some little cleanup here and there about different things, added some other regulations that are pertinent to contemporaneous data entry. Again, the whole backup thing, they've been basically restated to 1168B, or a portion of that. They've also linked to the CDRH guidance on the general principles of software validation to tie in backup and archive. So again, I think they have some of the same confusions that PICS had, as Chris talked about. All right, so here they've reworded this question 2 a bit, and basically they've aligned it with the OOS terminology coming out of this particular guidance, investigating OOS test results for pharmaceutical production. Nothing earth-shattering here, but just a much better alignment, talking about invalidating original data that was suspect and justifying that before having that. But again, the whole idea is that it has to be complete. You can't just discard the invalidated test results. You must preserve them for subsequent review as needed. Then for workflows, they've added really a risk-based validation approach, and that's sort of what that talks about. And then they've added this phrase, and perform properly, just to make it more consistent with a workflow that runs correctly. So there's that. Because you can't do anything to address that situation.
There you go.
So, all right.
Bob, this is Barbara. I think we lost your audio maybe a minute or two ago, so I don't know if you want to repeat yourself. Sorry.
Yeah, just on the items on this page where you were talking about key CGMP
record examples.
Okay.
Yeah.
All right.
Thank
So,
you.
all right. Yeah, sure. So basically, this is they just provided some with other examples. So include automated visual inspection records, electronic materials management system records, automated dispensing system weighing records. I guess they found, as they reviewed probably warning letters and 483s, that those were examples of systems that or records that sometimes got omitted. And then just they added this, I think, just for clarification, just to document how privileges are given to authorized personnel and what those privileges are. In question 5, they link back to this just for clarification. And then they added this new paragraph, which I think is very interesting. Someone who has review responsibilities should not have only a read-only user account. In other words, if they find a problem, they should be able to take action by modifying data or providing alerts, which a read-only user account would not provide. So I think they have some concerns about that. Blank forms, nothing new here, just some wordsmithing. Again, the complete record is what they're going after, so you can't have old data that you invalidate and then discard. You have to keep it in accordance with the record keeping retention periods. Then here are the two questions that were switched around. They've added who should review audit trails, and then cited other regulations that this might fall under. They then added a sentence about other flexibility for review, and basically I think what they're trying to say is that review is not limited to the quality unit. Then in how often should audit trails be reviewed, basically they're saying you'll see it's a complete rewrite, 3 new paragraphs. They got rid of the old, and basically they're saying it's a risk-based review frequency, is my summary of that. Other wordsmithing, all required to reconstruct the GMP activity for accurate reproductions of the records. Again, a lot more wordsmithing here, nothing really new or earth-shattering. They've added a micro example here and some different examples, colony counts and so on. And then other references to regulations or earlier definitions such as static and dynamic. They then add this element from Part 11. They clarify different chromatography record requirements here. So they're talking a lot about that aspect because basically that's where a lot of the data integrity problems, especially in warning letters, has come over the last 5 years. Again, further clarification of complete lab records. They've also added, interestingly enough, the veterinarian guidance from VICH. Again, regardless of intent, this is language that comes from a lot of the warning letters that talk about data integrity issues. And then I think they want to be sure that they don't accidentally get adverse events or field alert reports or bioproduct deviation reports into the drug info email box. So I think they added that to clarify. Then kind of wrapping it up, this is the final 2 questions here, 17 and 18. Basically, they clarified this earlier statement here, then they've added an enforcement warning and citing the guidance that came out of really the FDASIA law, but circumstances that constitute delaying, denying, limiting, or refusing a drug inspection. They've also added how they approach that and been very transparent by just saying, hey, the IOM is available. If you want to review it, you can see what guidance FDA is operating under when they're reviewing these electronic records. And then for the last question, they've added what I think are typical warning letter recommendations that talk about investigating, determining root causes, and having a management strategy. So they've basically summarized a lot of that wording that you see in these warning letter recommendations, added it into here, and that's it. So I'll just turn it back over to you.
Yeah, pass it back over to Barbara. Thanks, Bob. Really appreciate you going through that. I think it's interesting, the changes, and a lot of the things they did clarify, I know were specific things that were submitted to them as comments or questions that I had heard over the years, or during the 2-year period that it took to actually get it finalized. So it's interesting to see that. So appreciate it.
Thanks.
All right, Barbara, you want to bring back up the other presentation then, and we'll
next slide, I think, Barbara.
Okay.
Yeah, there you go. Perfect.
That one? Okay.
Continuing on the thank yous, the thank you to Chris for his presentation and the thank you to Bob for his presentation. We really appreciate them giving us the time. On to the good practice guide documents and where we are, and I'll ask Charlie to also jump in if there's any additional comments. What we affectionately refer to as GBG2, which I think is called DIMS by the editorial board, is on the manufacturing systems. We have to acknowledge Karen Ashworth for her work. She spent hours and hours trying to take what was 2 guides and create it as 1 guide. It's now in the final technical edit. It's been through the GDC with no additional comments. So once we finish the technical editing, it'll go for the final updates in any layout, a final check, and hopefully Q2. And I left it in red at Q2 because we had hoped to have it in the first quarter, but we got bumped by another guide. So it will be out in Q2, hopefully sooner than later.
Yeah, ISP's got a lot of things going through the editorial process right now, and some of them have taken a little longer, so it's impacting a series of documents. So that's partly why it got moved out. So
then the next slide, please. So now that we're seeing the end of that and a little bit of breathing room, we're starting to try to ramp up some of the other efforts. And what we're calling GPG4, which is really a replacement of the electronic data archiving guide, and really looking at practical approaches and the entire data lifecycle. We've had several meetings with the ERB to try, with the GAMP editorial review board, to try to make sure that we address the issues that are specific to data integrity and that are specific for industry problems. What can we offer as a solution? We're not trying to just generate documents for the sake of documents. We're trying to really solve industry problems. So the team has actually begun writing under the direction of Jim Henderson. We created a table of contents and have asked multiple people have volunteered to write. We need more people who are willing to write. There are some sections right now where there's only one person trying to write something. And though that may sound efficient to some people, it doesn't really gather what is one of the benefits of a team is various different inputs and various different points of view. So any volunteers, in a couple of slides, you'll see some emails so that you can contact us if you're interested in working on this. It is looking at the full life cycle, the full data life cycle. So any of the concerns, of course, it's a focus on the retention and retrieval and the archiving. So if you're interested, please contact us. The goal, ideally, is to get it up to leadership team review by May of this year. It's rather aggressive, so that we could turn it over to the GAMP editorial review board for June, so that they could enjoy it over the summer, and that or over June, so that we could then send it to industry and regulators for July, getting comments back, and then beginning the editing and collating of those comments with a goal of hopefully Q1 of 2020. Next slide, please. Charlie.
Okay, thanks, Laurie. So medical devices, we have a re-energized team. We started meetings in January. We've had 2 meetings so far this year. We've identified 2 case studies we want to write, one around software as a medical device. What's special about that in terms of data integrity in the design and development stages, in the healthcare provider use part of the medical device usage, and also what's special when we're talking about home use, so patient use directly. Our second case study is to be around IVD, so actual physical devices. What's special there? What special considerations, for example, do we need in manufacturing around the data integrity? We've got the ideas. We've got a core team of very skilled, very dedicated, very enthusiastic volunteers. I value them greatly when I say they are not enough. We need more volunteers to make these case studies happen. So if you have knowledge around medical devices, these are only case studies, so you're not committing to a full guide. We're just asking for volunteers to help us produce something that will probably be published in Pharmaceutical Engineering, or at most as a concept paper. So it's not a huge task, but we need dedicated people to work on this, to provide their expertise, and to really address for the first time within GAMP what's special in these medical device areas when we're talking about data integrity. There's also an initiative under Laurie's tutelage really around what do we need to address further around clinical and contract research organizations. So we have the eClinical guide, we have the records and data integrity guide, the data integrity key concepts guide. There may still be some gaps in that particular space, in the CRO space, that we have not covered in terms of data integrity. So currently there is work going on to try and marry up people from the old R&D SIG with like-minded folk in our DI SIG. Okay, next slide, please. Okay, so if you are interested in volunteering, either for the clinical and CRO effort or for the medical device effort, please email myself or Laurie. We would be really happy to onboard you and leverage your expertise and enthusiasm. And unless Laurie has anything to add, I'll hand back to Mike now.
Any other suggestions of topics, also please email us. We're always looking for other areas that people are interested in.
Yeah, you will. I'm going to make a comment. Note that Lori's email address has changed from what it had been on past slides, so please use her new email address. All right. All right, let's go to the next slide, Barbara. Keep us on track here since we're getting very close to the top of the hour. Just some upcoming conferences. The EU annual meeting conference is in Dublin the beginning of April. There is actually a track focused on quality validation and GAMP. There are some topics in there that relate to or are associated with data integrity. So I encourage you, if you're able to attend, to do so. The ISP annual meeting and expo is in Las Vegas this year, October 27th through the 30th. The call for proposals has now closed as of the 26th of February, and those proposals are being reviewed. The track leaders, if there are additional need for topics, can and will be reaching out to folks for additional information. Also wanted to make sure everybody's aware that the 2019 regulatory conference that normally is in June has been moved to December. That was done for the reason of balancing the schedule as well as avoiding some other conflicts that are out there. So again, the call for proposals is open until April 5th. of 2019. We missed the 9, sorry. Please submit your proposals if you have additional proposals for that conference. Okay, let's go to the next slide. And I'll turn this over to quarterly SIG meetings. These are the other 3 meetings that for this year that we have targeted and set up. The next one is on Tuesday, the 21st of May. Then we've got one in September and then one in November. We purposely scheduled the November one for about a week or so after the annual meeting. So just like this year, we can use it as a chance to debrief on the annual meeting if folks were not able to attend.
I have one other comment.
Sure.
There is a ISPE New Jersey conference that is being held in South Plainfield, New Jersey in the evening of March 28th. It's at Prolong Pharmaceutical in South Plainfield. Registration is from 5 to 6. The meeting goes from 6:15 to 7:30. Members are 40, non-members are 50, young professionals are 20. It's data integrity in the life science industry professional development meeting. If you are in New Jersey and want to contact me, or in the area and want to contact me about that information, if you cannot find it on the ISP website, I can send you the link. Again, that's March 28th in South Plainfield, New Jersey.
Excellent. Thanks, Lori. I had completely overlooked that when we put this previous slide together, so thank you. All right, let's go to the next slide then. Christopher, you want to talk about this one?
Yes. The data integrity knowledge sharing will be on the 26th at 11 a.m. And we haven't finalized the topic yet. We do have speakers lined up, but we're working out those details. If any of you on the call would like to be able to speak, please let us know on what you'd like to talk on, and you see my email there. So please give me send me an email, and we will we'll consider your nomination. Thanks.
Yeah, these are chances for folks to talk about pertinent topics or bring up topics. So encourage you to talk through those. Let's go to the next slide. I think we're at the top of the hour. Yes, perfect. So obviously, thank you everyone for your time. Bob mentioned that he has already sent Lori his the documents with the highlighted elements. We'll go ahead and put those out in the SIG collaboration space. The slides from this presentation will also be posted there. And if you've got any interest in getting involved in any of the teams that Charlie and Lori talked about, please reach out to them. Anything else from the leadership team for the good of the order before we try to wrap this up, since we're a couple minutes over?
Nope, but thank you everybody for attending.
Right. Yes, thank you everyone. And obviously, provide us feedback, provide us comments on the value of this. Like I said, we thought it'd be great to talk about the new guidances or the guidances that have come out and some of the comments and thoughts that are out there today. So we want to try to continue to mix up the types of information that we provide you. So everyone have a great rest of the day. Charlie, you have a good rest of your day on the 6th. And appreciate everybody's participation. So thanks a lot.
Thank you again to Chris and Bob.
Thank you.
Yes. Thanks to Chris and Bob, especially for their efforts today. We really appreciate you joining us. So
you're welcome.
Thanks,
Thank
everyone.
you.
All right. Thanks, everyone.
You guys.
All right. Bye-bye.
Bye.
Bye-bye.